Welcome to the module 19, which is very important. Day in, day out, we have been hearing about ransomware, cybersecurity breach, data breach. This is something that every doctor needs to know. And to take us through this journey, we have one of the world-renowned person, Mr. Ravi Puvvala. It's my privilege to introduce Mr. Ravi Puvvala, a technology entrepreneur, cybersecurity expert, and a Silicon Valley innovator. As a former vice president of cybersecurity and connectivity at Arma, a Samsung company, he led large-scale cybersecurity solutions protecting millions of connected devices and vehicles worldwide. A two-time founder with successful exits and extensive experience in AI, in connected systems, digital security, he brings a unique perspective on safeguarding critical technologies, especially in the medicine, in the health data, in the personal data, especially in the era of mental health taking precedence over all other forms. Today, he will share his insights on one of these very key topics. Please join me in welcoming Mr. Ravi. Ravi, welcome, sir.
Thank you, Dr. Suresh, and thank you so much for the opportunity. I'm really excited to talk about this particular topic. And as I've spent last decades working in cybersecurity for connected devices, and as part of my new company, Quantum Biosciences, we are really looking at how to capture the data to focus on ultra early diagnostics. So let me give a brief overview of what I'm going to talk about. India is in the fastest digital health transformation in its history. And today we have Ayushman Bharat Digital Mission, which is already live. And AI is entering hospitals and health IDs are being issued at a very large scale. And in the gap between adoption and regulation, patients are being exposed. Here is the clinical reality. A complete Indian medical record, sells for a few thousand rupees on the dark web. A credit card sells for a few hundred rupees. Unlike a password, you cannot reset a diagnosis. A compromised record is compromised for life. And every system in the hospital that is connected, the EMR, the PACS, the pharmacy, the AI. So breach in one node, it means you reach all of them. And the AI risk goes deeper than the data theft. So tools are entering into Indian hospitals for radiology, for sepsis, for surgical triage, are often procured without validation on Indian patient population. So the EPIC sepsis model that's widely deployed in the US also missed 67% of cases in external validation. So no Indian regulator currently mandates local validation before going live. So meanwhile, researchers have shown that imperceptible changes to imaging inputs can silently flip on AI's verdict, and the patient's faces can be reconstructed from a deployed MRI model without even touching the database. And thankfully, the DPDP Act 2023 binds every one of us. Treatment consent does not cover AI training consent. Breach reporting to the Data Protection Board is mandatory within 72 hours. And penalties can reach up to 250 crore rupees. And the hospital bears full accountability, even when a third-party vendor causes this breach. And most breaches in Indian healthcare don't begin with sophisticated hacking. They begin with a clinician clicking a phishing link, or a clinician sharing a scan on WhatsApp, or using a free AI tool without realizing the patient's data is a product. So this is the fundamental reason. Awareness to the upcoming, doctors, practitioners, is that the implementation layer, that every framework depends on it. And it's not just sufficient to say that the AI recommended it. It is you who are the doctors and the medical students decide, and that's the judgment applied to this new kind of risk is what your patients are counting on. And I'm looking forward to a detailed talk about all of this.
Wonderful. I think this gives the best possible teaser for our students to come prepared, for our senior professionals to introspect before they use any tool to be critically looking at it. Thank you, Mr. Ravi. Welcome, Subhakar, to this 19th module of NBMS. Can you please let our doctors know, as an industry expert, that what precautions we should take when the AI is coming into our practice?
Sure, sir, certainly. So as a doctors, you are the God to save the lives. the same time, you also need to make sure that you trust everything, like how you practice evidence-based, medication and all other things. While you trust every app and every, link and other things, but at the same time, be paranoid about verifying it before trusting. Don't trust anything until and unless you have an evidence that this is coming from a trusted source, and then be very clear about how it is being used, what data is being used, and be very, very sensitive about the all the frauds and all the other regulations activities going on. So as a result, be vigilant, right?
That's
And then
wonderful.
same way.
That's
Yeah,
wonderful. So just one, two quick tips. Anyhow, we are going to moderate this session on 3rd of this June. So two quick tips before we sign off the teaser.
Yeah. So one thing is trust, but always verify. Second thing is, make sure that you have the, evidences collected before using any apps or any links. And then everything has to be in line with the regulation, including DPDP Act and new AI and all that.
Great, sir. Eager to see you on 3rd of June. Thank you very much.